Taking a look at the COVID data in North Carolina, more people have gotten vaccinated, with 71% of adults fully vaccinated. There have been over 7,500 new cases reported today. 3,500 people are in the hospital, and the daily percent positivity rate now at 15.4%. And with COVID numbers decreasing, is it time to let your guard down? Not yet, says some doctors. The downward trend could be due to less people getting tested at sites that report data to health officials, and more doing at-home tests that they just got in the mail, where they likely won't report it if they do test positive for COVID, meaning there's more virus spread in the community than what people realize. Well, Queen City News reporter Will Lewis joins us live in the studio tonight. And Will, you talked to one doctor tonight who says she's seen a steady stream of people testing positive for COVID that are still coming into her office.
Yeah, I sure did, Brian. And she says some people are coming in not even thinking they have COVID. Many believe it's strep throat or the flu. So there still needs to be awareness that the virus is still out there. People ditching the mask, school districts changing policy recommendations, and the possibility Mecklenburg County will end the mask mandate. Are we moving too fast just because the positive COVID numbers are decreasing?
We may see a little bit of a surge, even with, some of the reduced measures, because of how rapidly Omicron spread. I don't think it's likely that we'll see the level of surge that we saw with this kind of massive wave of Omicron that we're coming through.
Dr. Genevieve Browning with Advanced Care South Park says underreporting of positive cases have always been factored in due to home testing and people not reporting positive cases.
With the recent surge, I certainly was constantly hearing from patients who had tested at home and were positive on the home test.
Browning says people need to remember COVID is still out there, and positive case numbers are high, and hospitalization numbers are high as well. But the numbers trending downward is a good sign. Also, if the mask mandate is lifted, it doesn't mean you can't protect yourself.
It doesn't mean you can't wear a mask and that you can't take extra measures to be safe. We've learned that masks work. We've learned that distancing works and that testing works. So all of those things are still in your power to keep yourself safe.
Now, Dr. Browning says a couple of things could cause a new spike in the virus. That would be the discovery of another variant and also the possibility of the gatherings over spring break. Brian?